In this video, we are going to be discussing about neck pain. Neck pain is one of the most common problems encountered by people, and everybody has undergone neck pain at some point in their life. Why is the neck so prone to pain? The neck has got a number of special characteristics which makes it easily prone to pain. Human beings are the only species which are actually standing completely erect, and that itself leads to a lot of problems with the spine. The cervical vertebrae are designed not to take so much of weight. The cervical vertebrae are actually quite thin and they are easily prone to pressure. Though the lumbar vertebrae are bearing a bigger quantity of the weight of the body, the cervical vertebrae also are not being designed for travel. Human beings have always been walking on their feet, and then there was no question of a vertical jerk. Whereas nowadays, people are subjected to vertical jerk because they are traveling on vehicles. Unfortunately, the vertebral column is not so well designed to bear this vertical jerk that happens when one is traveling. There are several other factors that predisposes a person to neck pain. One of the most common causes of neck pain is what is called as a muscular spasm or tightness of the muscles. This is the most common cause of neck pain and is very transient. There can be neck pain when somebody just stretches himself for some period of time, when somebody is really focused on a job and loses consciousness of the posture in which the neck is present while he is working on a computer or on several other, he is watching a TV or something like that in an odd position where his muscles of the neck are not in balance. When one group of muscles of the neck are strained disproportionately over a long period of time, they go into spasm. And that spasm causes severe pain in the neck. But very often the characteristic of neck pain that is caused by muscular spasm of this nature is that it will pass away over a short period of time. And very often it also responds wonderfully to the use of something that relaxes the muscles, some massage, as well as with some painkillers or muscle relaxants which are able to provide immediate or very quick relief to muscular pain that is present in the neck. There is another very common cause of neck pain which is due to the prolapse of the disc. Neck pain that is produced by the disc-related problems tend to be more chronic and do not fluctuate so easily. They tend to be prevalent over a long period of time and very often are not just restricted to the neck, they also radiate to the upper scalp, to the shoulders or to the hands. And once it reaches that stage, it is no more just neck pain, there is pain in the neck and hand complex. So neck pain can be part of the cervical radiculopathy. Another very common cause of neck pain is chronic stress. Chronic stress again produces neck pain through producing muscular spasm. Patients who are chronically worried about something, then the extent of worry is not the issue. There need not be a very severe level of stress, but if the patient is continuously stressed over even a minor amount of stress, if the chronic stress is prevalent in a patient, that can lead to chronic muscular spasm, the muscles of the neck being extremely tight, which leads to chronic neck pain. Postural problems, as I mentioned earlier, can also precipitate tightness of the muscles leading to neck pain. So thereby neck pain needs to be clearly classified into what the cause of neck pain is if one has to know what sort of treatment would be effective in neck pain. Very often we find neck pain that occurs also gets corrected naturally. If you have a good night's sleep and you sleep in a proper position, the neck pain is relieved. But whereas there are also conditions where neck pain gets aggravated when one goes to sleep and wakes up in the morning, neck pain is severe. Very often that indicates the posture in which one is sleeping is not appropriate. For example, for a person who lies down flat on his back, using a very high pillow can very often be a cause of neck pain because it creates an angle, it creates a forward bending of the neck which puts pressure on the muscles of the neck leading to neck pain. At the same time, a person sleeping on his side who does not use a pillow is also producing stress because the neck actually tilts to one side and that produces a lot of strain on a group of muscles on the neck leading to pain in the neck during the next morning. So a large extent of neck pain can definitely be managed by taking care about the posture in which one is keeping the neck over a prolonged period of time. Nowadays, with the continued use of computers and laptops, and now even more the use of mobiles into which one is constantly looking at over a long period of time, is a very severe, very common cause of neck pain, which again causes that by putting a strain on the muscle groups. So by taking care of the posture and by using certain oils and ointments to give massage to the neck, one can definitely avoid or manage a number of cases of neck pain conservatively. The neck pain that is caused by a more intrinsic, more serious cause, which is cervical spondylosis comprised or cervical disc disease leading to radiculopathy or neuropathy, needs more intense treatment. Very often even that gets relieved with some period of time, but in many cases the pain associated with cervical radiculopathy or cervical disc herniation doesn't get relieved very quickly, and very often sometimes they are also referred to undergo surgery. But Ayurvedic treatment is very effective in treating patients with cervical radiculopathy and avoiding surgery completely in almost all cases. Ayurvedic treatment comprising of certain medicines which can be taken is itself enough in majority of the patients, along with some oil application which the patient can do at home. That itself is seen to be extremely effective in giving very good relief and avoiding the need for surgery in majority of the patients. However, very severe cervical spondylosis with radiculopathy leading to numbness and so on might sometimes need Ayurvedic therapies or inpatient treatment in a hospital, Ayurvedic hospital, to be able to completely get rid of the problems associated with neck pain due to cervical radiculopathy. So we at AVN Arogya offer wonderful Ayurvedic herbal based medicines which are capable of relieving the neck pain in several patients with only as a standalone medicine and with the application of some oils. In cases which are severe, we admit patients in our hospital or administer therapies which in our centers in the different cities, which help the patients to completely get rid of their neck pain, which keeps nagging them for days and years together. And there are even patients who have considered giving up their job because of problems relating to the neck pain, but who have been able to continue with their jobs and lead a normal life with just taking some medicines and applying oils and so on and so forth. So that is how AVN Ayurveda is able to provide a comprehensive solution to people suffering from neck pain.